Welcome back to Go Ask a Nurse podcast, where we dive into real conversations with healthcare professionals to help you better understand your health, your options, and your voice in care. I'm your host, Anna Marie, a nurse, educator, and advocate for empowering patients to take charge of their health. Today, I'm honored to be joined by Dr. Linda Hardy, PhD. Dr. Hardy is the current president of the Nebraska Nurses Association, a dedicated nurse educator with decades of teaching experience and highly respected leader in the nursing profession. She has spoken at numerous leadership conferences, received multiple professional and community recognitions, and continues to inspire through her mentorship and advocacy. Dr. Hardy and I dive into the nationwide nursing shortage and what it means for future healthcare professionals. Whether you're a high school student considering a nursing school, a career changer, or simply curious about the profession, this episode covers everything you need to know. Dr. Hardy shares expert advice, personal insights, and practical tips to help you navigate your journey from student to healthcare hero. Dr. Hardy, thank you so much for being here. I'm so honored to have you on. Can you just tell us a little bit of your background and what you've been doing all these years with nursing?
Okay, so I have been a nurse a registered nurse since 1976, so 49 years. I went to a diploma program, which were more prolific back in those days. Those were hospital-based programs. And then I went back to school and got my Bachelor of Science in Nursing in 2001 at Nebraska Wesleyan University, and then my Master of Science in Nursing in 2003 from Nebraska Wesleyan. I started teaching then and ended up getting a PhD in nursing education. I specifically wanted to focus on nursing education, and that was in 2011 from the University of Northern Colorado. It was primarily an online program, and I know we may talk in a little bit about what online options people have as far as their education. Since that time, I've taught full-time for 16 years and managed the nursing programs at Nebraska Wesleyan, and still teach as an adjunct, usually one class a semester. So that's kind of my educational background. My nursing clinical experience has been across the board: labor and delivery. I've worked in long-term care. I've been a school nurse. I've also worked in our small hospital in Wahoo, Nebraska, which is now a critical access hospital. So I have a broad range of nursing clinical experience.
What has been your favorite clinical experience?
Actually, I have to say labor and delivery was still my favorite. I taught childbirth preparation classes for over 20 years, and that was my first love and probably still is. But school nursing was fun too, to be with the kids. Most of the time it was fun. I have to say I haven't had any nursing experience that I didn't love in some way. Hopefully we can convince other people to give nursing a try. And I liked that challenge of becoming an expert in a new area of nursing.
Can you kind of paint a picture of the current nursing landscape in the Midwest of the shortages here in our region, some of the burnouts maybe you kind of see overall?
So across the whole country, and I'll just quote this one stat. I don't want to get too technical here, but this really hit home to me. This is from the American Association for Colleges of Nursing. So it's a good resource. They say that there's a shortage of 78,610 full-time registered nurses in the United States this year. They project that shortage to increase over the next few years. Part of that's related to, I gave my background, so anyone can figure out how old I am. People my age of nurses are retiring. Some nurses, sadly, are leaving the profession because of burnout, which, that term gets bandied about. But what that really means to people is they cannot face the staffing shortages, the feeling that I've had nurses tell me this, the feeling that they cannot provide the type of patient care that they know our patients deserve and our citizens of Nebraska and our whole country. So I think those things contribute to this shortage. Another thing I want to mention that I don't want to forget to mention this is we also have a shortage of nursing faculty. So if you don't have enough nursing faculty, you cannot accept all of the potential students that are qualified to be in your nursing program. So we have a double whammy there. We don't have enough faculty. Sometimes clinical sites are at a premium. I helped drive the first pre-licensure program at Nebraska Wesleyan, and one of the biggest challenges I had was arranging for our students to have clinical sites. So that enters into the overall problem. So yes, we need to find a way to get more people into nursing. And I hope maybe you and I can make a little dent in that problem with this discussion.
One of the most common questions I get from the listeners is where do I even begin if I want to become a nurse? So this is going to be a great start to this conversation for those who are inspired to step up and join this profession. Can you walk us through the first steps someone should take to become a nurse today?
Okay, so I guess I would encourage, regardless of where you are in your life, whether you're a high school student or an adult, I mentioned earlier about going back to school when, later in my life, I was already an RN, but going back to school to further my education. So wherever you are, if you have not had any experience in healthcare, I strongly encourage anyone that talks to me to be a certified nurse aide or a CNA. That involves a 75-hour class. You then pass a written and a skills test. I would say you would have no problem finding a job as a CNA because we don't have enough CNAs either. And that gives you the experience of working with patients and working with their families so that when you do go to nursing school, you will already have some level of comfort as far as working in the healthcare field. You also get an opportunity to see what LPNs, licensed practical nurses, and RNs, what they actually do on a day-to-day basis. So if you're not even sure if that's the route you want to take, being a CNA will help you decide that. And I will say, and maybe you'll disagree, but if you can do the work of a CNA, you most certainly will be able to do the work of an LPN or an RN. Some of the work that CNAs do, they are some of the hardest working healthcare providers that we have in the system. And I can't applaud their work too much. It's hard work. It's amazing work. And it really will help them help the person decide if nursing is the route that they want to take. And sometimes people say, oh my God, nope, this isn't for me. And that's okay too. It's good to find out if this is the right direction that I'm taking. So I say be a CNA. A lot of high school kids do that, and that's a great part-time job for people. I've been the director of nursing of a long-term care unit, and I was so thankful for our high school students that were CNAs because it really helped a lot. After that, then you make a decision about, there's a lot of different routes. You can be a licensed practical nurse. Typically, that takes about a year, maybe a little more. Some of them are 18 months. Those programs are typically housed in community colleges. here in Nebraska, that might be like Southeast Community College, Mid Plains Community College, which is out in North Platte. Many of those programs then also offer, some call it a bridge program, an LPN to associate degree RN. So an associate degree RN still takes the NCLEX, which is the national, used to be called state boards, because each state had you pass the test to be a registered nurse. Now it's a national certification, and everyone takes the same test. So after you get an associate degree or a Bachelor of Science in Nursing as a pre-licensure degree, everyone sits for the same test. That test is designed to ascertain if you have the basic skills to provide nursing care at the registered nurse level. So that everybody takes the same test. So if you have an associate degree, you're an RN. If you pass NCLEX, you're an RN. If you have a Bachelor of Science degree in nursing, you're an RN. Other options, going straight for a BSN, a pre-licensure program. So lots of schools have those. I mentioned Nebraska Wesleyan has one now, includes Bryan College of Health Sciences, Creighton, University of Nebraska Medical Center. There's Clarkson, I could go on and on. I actually have a list sitting here, but I don't think you want me to read the whole list. So any of those would be an option for people. There's also an option, some call it a second degree program. Some people call it an accelerated program. Those programs are designed for people who already have an undergraduate degree. So a bachelor's degree and some other, like it might be in biology, it could even be in English. There's certain prerequisites that they have to have taken. So that might be like a biology class and that sort of thing. But those second degree programs are designed for the person to, and I like calling them an accelerated program as well, because they spend a whole lot of time in the clinical areas. Usually a lot of those programs are 15 months. Some of them are 18 months. Creighton has one. University of Nebraska Medical Center has that type of program. Bryan is working on one. If they haven't, they may not have rolled it out yet, but other places are looking at that type of program. And I know a couple of nurses that did that type of program, and they said it was challenging because it's a lot of clinical. But they also were able to then sit for and take the NCLEX exam and be a registered nurse with a Bachelor of Science in Nursing degree. But that kind of gives a good overview of all the routes there are to be able to be a registered nurse and be able to get your license as a registered nurse.
One thing I was really impressed with is that I am seeing more and more males getting their CNA and starting. And I talked to this one guy. He came in, it was his first day. He was so excited. He just graduated high school, and he just said, I want to be a doctor, a surgeon. I'm not sure what kind of surgeon, but I thought being a CNA first would be a good way to start. And I said, absolutely. I wish every doctor was a CNA first, because it gives you the opportunity to learn those basic skills of working with the patients. Just get you more comfortable getting, learning patient care. But I was so
I,
proud of him.
I
And
totally agree with that. And we want more men in nursing too. In Nebraska right now, I think we're sitting at maybe 91. I haven't looked most recently, but around 91 or 92% of our nursing workforce are women. So we're trying to get more men. And I think we are. I just spoke at a nursing class at Southeast probably about a month ago. And I'll say there were 20 students in the room, and there were like 4 men, 3 or 4. And that's more than typically you would see. So yeah, I think we need to recruit more men to help increase. Diversity isn't just about what our race or our ethnic background in. Diversity in nursing is also about getting more men into our profession. So,
Yeah.
and our next president of NNA is a man. So, and he was actually a second degree nurse. He already had an undergrad degree from a university, and then he did a second degree type program that I mentioned. So,
That's
and maybe
great.
that will help. Maybe his example as our next president of Nebraska Nurses Association will help us recruit more men into nursing. Nurses can also continue on to a doctorate in nursing practice, which typically you'll see that with nurse practitioners. CRNAs, the nurse anesthetists, typically have a doctorate now. It used to be master's level, but now it's doctorate. And we also have certified nurse midwives who typically now have a doctorate rather than a master's degree. So there's areas that you can continue your journey in nursing to a different type of care and a different level of patient care that you're providing.
What personal qualities or interests should someone have to consider a nursing career?
Um, well, I think not to scare anyone away, but there's more science involved in nursing preparation than people realize sometimes. So I think having at least an interest in anatomy and physiology and biology. And if you're a high school person or a parent listening to this, encourage your child to take those classes when they're offered in high school. I know a lot of high schools do offer anatomy and physiology, and that would really help the potential nurse if you had some of that background to start with. Um, I believe, people say nursing is a calling. It was for me. It truly was. Um, I, in high school, was agonizing over what I should do. And I don't think it was God talking to me, but I definitely heard, I'm putting heard in quotes. You can't see that, but I'm putting that in quotes, that nursing was the path that I needed to take. And it took me a little while. I did some college and then came back to school. Um, but I felt a real desire to be able to, it'll sound trite, but to be able to help people and to be in a position to help them either improve their health or help them transition. If, end of life care, we haven't talked about that at all, but end of life care is an important part that nurses can provide to really support the person and support their family as their loved one is moving to the other side. Probably, I would say one of the biggest honors I've had has been both to be at the beginning, at birth, and at the end when I've sat with patients. I can think of two or three that didn't have family, and I've been able to sit with them and be with them as they passed. And that's a huge honor to be able to do that. So, does everyone have to have a calling to be a nurse? Probably not. Will it help you if you do feel a strong desire to impact the lives of your patients and their families? Probably it will help you. It'll help you get through those rough times when it's hard and you think, what am I doing? Did I make the right decision? Um, I think it will help. I'll turn it back to you. What did you think of when you decided on nursing?
That is a great question. You know, at the age of 18, I was not thinking about wanting to become a nurse. And honestly, I did, science was the worst subject for me. So going into nursing, if you would have asked me if I would have ever been a nurse, I would have laughed, because that literally was not my strong point. Taking all those science courses was not a strong point growing up, and not something that I really did a lot of. I tried to avoid them. And now looking back, as I did grow up and mature and got older, I went to nursing school at the age of 35, and I became it's something I became very passionate about, because my dad's health started to decline at that point. He had found out that he had a form of cancer, and there's a lot of stuff that I really did not understand. I did not know, and I wanted to know more. And so, with all the classes and all the education I continued on doing to get into nursing school, I only needed 2 classes to get into UNMC, to get my bachelor's. And I did it. I was encouraged, all the doctors around me encouraged me to go back and just get my nursing, to have that. It helped me with so much, just to have the knowledge to be able to help advocate for my family, definitely my parents, and I wanted to know more for myself. And that's been my journey of how I got into nursing.
Good point. So, like I guess I stand by. Do you have to feel that calling? I mean, you mentioned it too. Do you have to feel that to be able to be a good nurse? Maybe not, but will it sustain you? When nursing classes are not easy, and sometimes, people can get discouraged with that. I think having that commitment to the profession that they're aiming toward is more important than what their grades are. Now, admission to nursing schools, okay, they still look at grades, and it is challenging enough that, if you're a good traditional student, I'm saying traditional, like you got good grades in high school, etc., some of the classes will be easier for you. But if you don't have that desire to provide care to people when they are most needy, it will be hard for you to sustain through all the classes that you take in nursing. I'm hoping people will feel that calling. I've interviewed potential students a few times that were like, well, I heard it was a good job and you can get good pay. Well, the pay is better than it used to be. I'll share on here with you guys my first job as a graduate nurse, because you could work as a graduate nurse until you could take state boards. My first job was $3.25 an hour. And I guarantee you get paid way more than that now, thankfully. But, when a potential nursing student says, well, I heard it was a good job that you could get decent pay, that might be really hard for a person that's their primary driving force. I think you really do need to have a desire to help other people, because you do hard things when you're caring for people, and you are seeing them at their most vulnerable state, and sometimes their families at their most vulnerable state. So having a true heart for wanting to serve other people really does help.
I think you kind of did this, but we can, the different entry points into the nursing today of LPN, ADN, BSN, and the accelerated programs. But we can kind of break it down more, if we want to. LPN's a great way to get started into nursing. But the difference between maybe looking into if someone's considering being an RN, should I go ADN route or should I go BSN route, um, to become an RN?
Well, part of that depends on what your overall goals are. Now, clearly, I've given my background here, so it's no surprise that I am a great proponent of nurses being highly educated. Having said that, everyone has a different life situation. Some people cannot literally afford to go to school for 4 years. Even if there's scholarships to help, they may be supporting a family. It may be a single parent in school. So you have to kind of look at the overall picture to decide what would work best for you. I actually have, she would be my great niece who just graduated with her RN. She did the route of LPN first, then it was a bridge program through a community college, and she was able to work part-time as an LPN. So she had some income while she finished and got her registered nurse degree, then her associate degree. There's a fair number of programs that if you have an associate degree, then you can get a Bachelor of Science degree. I can't tell a person what they should do without a conversation with them about their overall life situation, because that really does have bearing on it. And I think that's a wonderful thing about nursing. Look at how many different options people have to get into our profession.
As we have talked about, there are more flexible and online options for working adults who are changing careers. So that has become beneficial. But what are your thoughts about that? I know it's great to have those online options, but as a nurse and being in nursing, um, I'm a hands-on learner.
Mm-hmm.
So it might not suit everybody who don't learn that way.
Well, and I think it depends on what program you're looking at too. If you're talking about a pre-licensure program, it totally has to have experiential hands-on learning, at least some part of it. Now, could some of the classes be online? Sure. Most BSN programs, I don't want to scare people off, but you have to learn about nursing theories and how that provides a framework for our profession. That doesn't have to be an in-person class. That totally works well as an online class. So some of the classes can be an online offering, and some definitely need to be a face-to-face class with a clinical component where the student, and with labs where the student can, sim labs where the student can practice in the sim lab before they're actually with real life patients. A lot of programs use standardized patients, which are real people. They're kind of like actors and actresses, and they're real people. And medical schools are using that format as well. So the student actually gets the opportunity to interact with a real person, not just the sim dummy. I'm putting dummy in quotes, but so it really depends on what type of education. I think early on I mentioned my PhD in nursing education was primarily online. Now I was on campus in Greeley, Colorado a few times, but most of my courses were online, and that worked well for that type of program.
But at that level, getting your PhD, I mean, you've had years of experience of being a nurse.
Exactly.
And so it's,
Exactly. And that a nursing education program isn't going to involve a lot of hands-on pieces. I don't know if you're going to ask me this question, but I want to throw it out there so I don't forget. When you're looking for a program, please be sure you look to see if your program is accredited. There's two primary accreditation bodies in the United States. One of them is called, I'm going to make sure I say it correctly for everyone. One of them is the Accreditation Commission for Education in Nursing, or those in nursing education fondly call it ACEN. That program accredits everything from LPN clear up to a doctorate in nursing practice. So they accredit programs across the board. The other primary agency is CCNE, which is Commission on Collegiate Collegiate Nursing Education, and they only accredit BSN or higher levels of programs. So when you're looking and deciding where you want to go and how you want to go about your education, please be sure that you check to make sure they're accredited. And speaking from the school side of it, the program side of it, I can tell you it is very extensive to get accredited by either of these bodies. Our program at Nebraska Wesleyan had accreditation first from, well, it wasn't called ACEN then. And then we switched to CCNE. So I had the pleasure of going through accreditation by both of these bodies. And I can guarantee you that if your program's accredited, they have done everything they can to be sure that you are being offered a quality program and that your outcomes will be good. So I didn't want to forget that, because anyone that's looking, please make sure that you check to see if the program you're looking at is accredited.
No, that's a great point. And I think that there's so many, um, when you get online, you're going to be overwhelmed when you're trying
Huh?
to find um, a program, let alone are you thinking about whether it's accredited or not? So before you sign or do anything more with it, making sure it's credited is extremely important. Otherwise, everything that you worked hard for will not matter.
Yeah. And in the past, we have had programs here in Nebraska that were not accredited, and there were not good outcomes for the people who paid their money to go there. I won't name names, but in the past, that has been an issue. And right here in our own state, right here in Nebraska.
What kind of resources, scholarships, or programs would you recommend for someone concerned about tuition?
Really good question. Most colleges or universities have, good financial aid that they offer their students. Um, there's anyone going to college should look at that. There can be some that are specific for nurses. Some colleges have uh, specific scholarships. Actually, a friend and I, another nurse educator, we retired at the same time. And there's not a lot of money, but we started a scholarship. We called it the Future of Nursing Scholarship. Um, and so over time, that will build up. So look at where you want to go and see what they have to offer. Um, there's also some grants that, uh, because there is a nursing shortage, there are some grants that students can get. There's also grants for nursing faculty. And actually, when I was in my master's program, I got a grant that was forgiven after I taught. I think I had to teach full time for 3 years, and then that grant was basically wiped out. I didn't have to pay back any of that. So there's programs like that. Some are federal level and some are state level. One of the bills that I testified on just this past legislative session was trying to get our legislature to add more money to a nursing scholarship fund. Um, and we weren't as successful as we had hoped, but it's on their radar, and we'll Nebraska Nurses Association will be back lobbying for that again next year. Um, so there are even some state level, but we think they need to put more money in it to help get more nurses in our state. So there are financial options. And some of them do require, which makes sense to me, you have to work X number of years as a nurse for that scholarship or the grant. It's usually when it's a grant, then you don't have to pay it back if you work X number of years. The ones that are state focused or that come from our state require you to stay in Nebraska to work.
Do you probably find that there's more for, Nebraska is loaded with rural areas and small
Yeah,
rural
and
hospitals.
so I know there's it's called RHOP. It's Rural Health. I'm not going to say the rest of the word because I don't remember, but it's an initiative. That one is focused on getting physicians to rural areas, but there's also been discussion about that type of program to get more nurses in rural areas. Because Nebraska is a rural state. I mean, I live near Lincoln and Omaha, and we're close to the population, the bulk of the population in our state. And people may not know this, but there are, I think, maybe 5 counties in our state that have 0 registered nurses that even live in that county, out in the rural area of our state. Well, and you came from what I would call a rural area of the state, and so the challenge it is in those areas to get enough nurses. But following a person, shadowing, you really get to see on a basic level, a day-to-day level, what is this job really like? So you'll see the good, the bad, and the ugly all in one fell swoop. And that really will allow you to make an informed decision about what career path you want to choose.
What are hospitals and nursing schools doing, or what should they be doing to turn the tide? Do you think investing in mentorship, mental health support, and better pay could help the retention?
Most of the things I've read, better pay is almost always mentioned. Nobody's going to turn down a salary increase. But I am not convinced that that's the driving factor. I think staffing is a huge piece. You just talked about your own experience of coming on, and nurses had 10 patients. That has to be addressed by the hospitals. I'm not sure schools can address that so much, other than maybe really trying to encourage healthcare facilities to work more toward appropriate staffing measures. Some states have ratios required. California is one. They've had it for 10 years, I think over 10 years, where it's depending on the acuity of the patient. It might be 5-to-1. If it's an ICU or critical care situation, it might be 2-to-1 is the lowest ratio. And I don't know if that's what we need or not. I'm not positive that that's what we need. It may encourage healthcare facilities to work harder at how they're going about recruiting and how they're going about retaining nurses. Because you can recruit a nurse and have him or her come work there for 2 months, and they're like, this is horrible. I'm done with this place. I'm done coming to work and being assigned 10 patients when I know I cannot adequately care for 10 patients. So that piece is the healthcare facility piece. And some are really trying to figure out different ways to recruit and retain nurses. I've heard nurses say, don't just give me a pizza party. That isn't going to help me want to stay. That's like putting a Band-Aid on a cut that needs to be sutured. A Band-Aid isn't going to do it. And maybe one of the solutions is to let the nurses that are, I'm going to call it in the trenches, the nurses in a acute care facility, in a hospital facility, or even a long-term care facility, the nurses that are providing hands-on care to the patients need to be part of the discussion of what can we do, how can we do it. You're right there. Not like I said, I've been a DON. I did not have, I had to rely on my nursing staff to tell me some of the things they needed. Now, I also, and I would encourage anyone in administration to do this, I also came in at 3 in the morning to help. And let me tell you, there were some shocked look on the faces of the staff that was there, that the director of nursing came in the middle of the night to help. And clearly I didn't do that all the time, but I periodically did that. And I would suggest that to anyone in management. You need to be willing to see what your nurses and your nurse aides are doing and how you can help them from that very basic level.
Having your director of nursing or a nursing leadership come in during the middle of the night when help is needed shows staff several powerful things. One, commitment and support. Leadership is willing to step in, not just give orders from afar. Shared responsibility. Patient care is everyone's priority, regardless of their title or shift. Respect for your staff. It demonstrates that leadership values and understands that challenges the frontline nurses are facing. Teamwork and morale, that the staff feels encouraged and motivated knowing that they are not alone, which can boost morale and reduce burnout. And you're leading by example. Leadership models the behavior they expect, reinforcing a culture of accountability and patient centered care. Um, this is so important as you're modeling this. When I was the director of nursing and I helped out with the COVID, and I was out there in below 0 degrees helping my teamwork get people tested, knowing that the faster we go, the faster they can get out of there, but they're not in it alone. And it really did boost the morale, and people actually came into work, and I was there to support them as you were there to support your team. But what's unfortunate is, a place where I work, and you see it so often in hospitals where there's so many charge nurses, and it's like pulling teeth getting them to help you out when you're drowning. And a good leader doesn't let their team drown. And that's unfortunate, because that's what new nurses are seeing. And I think that's where burnout can come in play. But, having those higher management really model, it has to start from the top up, model down as it trickles down to where we're supporting our staff, really speaks volumes, and it can change so much within the corporation. And so when you come to want to pick a place to work for as you get into nursing, as you start out, you want to look into those kind of organizations that are willing to take care of the staff, because it's not always going to be about the money. I mean, they only can cap out, but you want to work for a place that's going to have your back and
Exactly.
not sink you.
Yeah.
You're it's
That's why I said it isn't just about the money. Sure, that you want to have a good paycheck from wherever you're working, and you want to be compensated for the hard work you're doing. But that isn't always the driving factor. You know, the workplace conditions, and the camaraderie between nurses. Nurses need to have each other's back too, and
Mhm.
not be so quick to judge. Oh, she should have done this, or that nurse didn't pick up on this. Well, we're in this together as nurses, and we need to have each other's back. Um, and if someone needs a little educating, then experienced nurses should provide that education.
And that's how we keep those newer nurses. I think we can scare them off by not helping them out.
Exactly. We can't be judging them. We need to be helping our new nurses,
Yeah.
helping them feel a part of the community and a part of our profession. and not putting them down and making them afraid to even ask a question. But they should not be afraid to come to a seasoned nurse and ask for their help. They shouldn't be afraid, like, oh, I don't want him or her to know that I don't know this. Well, you can't know all of that. Some of what we learn, nursing intuition is based on experience that you've had as a nurse. And that helps you develop your intuition and being able to ask seasoned nurses questions without being fearful that you're going to be ridiculed for not knowing the answer. That's so important for our profession.
And as you know, I've been a nurse, for the little over 10 years. And when I tried to be an instructor, a clinical instructor, I felt judged because one, I'm not an expert in everything. And so when I try to utilize the nurses that are experts in those areas to help these students learn, I can teach them the right way, but when I haven't started an IV in a really long time, that's just not part of my everyday thing. I'd rather them learn from someone who does it all the time. I had a nurse call and complain that I hadn't done that. Like, I don't know how to do it. I do know how to do it. Um, but then I had another nurse who was like, "Oh yeah, absolutely. I'd love to show the student nurses that's how we should be. Helping
Exactly.
each other out." I was honest. I was like, "I haven't done this in a long time. I'd love for them to learn. If they have an opportunity to learn, let's show them." But also, you want them to see how nurses work together. Unfortunately, they're seeing the other side of how nursing can be to each other.
Good point. I did one semester after I finished my master's as a clinical instructor in OB. So I was in labor and delivery in the nursery, and it was a big hospital that was very busy. And so I would introduce myself to the nurses and or the physicians or the midwives that were doing the deliveries as a new instructor, but a very old nurse, because I felt like I needed to make sure they understood that I had clinical experience in my background. I might be a new clinical instructor there, but I felt like I had to justify my knowledge base to be accepted by him. And I remember coming home and telling my husband, "Oh, they finally accepted me. They let me stay in the nursery without another nurse in there." So the nurses on the floor were having to check me out to make sure they could trust my nursing abilities. And maybe that's okay. But yeah, it's a challenge. And when new nurses are having to face that too. I was a seasoned nurse, pretty self-confident. So I kind of laughed about it. Well, they finally trust me. I got to stay in the nursery without one of their nurses in there with me. But brand new nurses don't have that confidence. And we just really have got to, as seasoned nurses, we have to protect them and support them as best we can.
I think conversations like this are so important because they can inspire the next generation of nurses to step up. And I think part of solving this crisis is exactly what we are doing here, talking openly about the challenges and highlighting the values of nursing. If more people understood both the rewards and the need, I believe we could inspire more to join this profession. Well, I have really appreciated our time. We have covered a lot of different areas. I think, for anyone going out there looking at getting into nursing, no job is ever going to be perfect.
Nope.
We're all going to have, they're all going to have their little quirks and experiences. And so, but the great thing about nursing is there's definitely so many different areas that we can go into nursing. Lots of different options and opportunities for growth. And just getting started, I think we really covered that. But Dr. Hardy does so much in the community, and being the president of the NNA, she is always helping and doing a lot within our own community right here in Lincoln. So thank you for your insight and your passion and for helping protect the future of nursing. Before we close out today's episode, is there one message you want to leave with our audience, especially any future nurses listening right now?
Well, I guess this message. Actually, when we renew our nursing license, one of the questions they ask is, in hindsight, would you change your profession? That's not an exact quote of what they ask. I absolutely would not. I've had people say to me before, why didn't you be a doctor? And I've said, I'm perfectly smart enough to be a physician. I chose to be a nurse because a nurse really focuses on the whole patient, their family, their community, and I would not change the opportunities that I've had as a professional nurse for anything in the world. So that's my message. If you decide nursing is for you, you will not regret it. You'll have your ups and downs, but you will not regret it. It's incredibly rewarding, and you're doing something outside yourself that's for the good of the people that you love and your community.
Thank you again to Dr. Hardy for joining me on today's episode of Go Ask a Nurse. Her experience and insights shed light on the challenges and opportunities in nursing today and offer valuable guidance for anyone considering a future in this incredible profession. If you're inspired to explore nursing as a career, I hope this conversation gave you clarity, encouragement, and practical steps to get started. Remember, nursing isn't just a job. It's a calling that changes lives, including your own. Until next time, take care, stay curious, and keep asking questions. Be blessed. The information provided on this podcast is for general informational and educational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition or health concern. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. The views expressed by guests on this podcast are their own and do not necessarily reflect the views of the host or Go Ask a Nurse.